First of all, let's get out to Laura Kavanaugh, who's out and about this morning. Laura, good morning.
Hey, good morning to you, Mark and Heather. You know, prostate cancer is one of the leading causes of death among men. And today we want to make sure that we empower you, that you know your risks and how to stay cancer-free. Joining me right now, Dr. Paul Dato of Genesis Healthcare. Come on in here. Prostate cancer, this is Prostate Cancer Awareness Month. 1 in 6 men will be diagnosed in their lifetime. But the good news is, with the help of gentlemen like yourself, it can be detected and treated very easily.
Absolutely. We recommend certainly early screening with a conversation with the patient regarding the risk of screening. But the digital rectal examination as well as PSA testing is key in terms of detection, diagnosis, and then be able to proceed on with staging of the patient and then be able to offer treatments.
Now, who is at risk? I talked to you about some symptoms, but sometimes you're not symptomatic until it's really bad. First, let's talk about symptoms. If it were an aggressive stage of prostate cancer, what symptoms would you look for?
We think about pain first because of the known spread pattern of cancer to bone. There may be other things like flank pain because of obstruction of the kidneys that can occur, as well as obstructive voiding symptoms because of the location of the prostate beneath the bladder.
Okay, also, people who are at risk, this is a big deal. This may require you to get tested a little bit earlier because early detection is key. That's
correct. Guidelines suggest beginning testing or screening at age 50. Earlier, if there's a family history of early prostate cancer, beginning perhaps as early as 40, but that's again a discussion to have with your urologist, with your physician to see what's best for them.
Now here at Genesis Healthcare, really groundbreaking technology, not only in imaging, but in treatment. Can you tell us a little bit more about how exciting news this is?
Yes, again, in the last 4 to 5 years, we've really seen an explosion of medications that are indicated for advanced prostate cancer. It's cancer that has spread, that is no longer responding to the usual hormonal therapies that we use. Medications like Provenge, Zytiga, Xtandi have really revolutionized how we are managing these patients. We're providing them hope with those medications to be able to live longer and also live better. There's medications to assist in bone health that can assist in terms of pain as well as reduction in the risk of a fracture and pain. So we're doing a lot of that information, a lot of that treatment, as well as offering research studies that can be beneficial.
Dr. Michael Kipper, if I could bring you in here. Dr. Michael Kipper, you have an example of, I believe it was a picture of one of your patients. This is an example of prostate cancer that has really spread throughout the body. The good news is this patient has been treated and is alive and well.
Yes, and this is one of the take-home messages that with so many different ways of treating now, we can treat these patients, we can prolong life significantly, and we can now utilize so many of the things that Dr. Dato uses to sequentially treat the patients until the magic bullet comes along. This patient shows spots on the bone scan, every one of them indicating an area of tumor to bone, but these patients can be pain-free and can show wonderful response to some of the things we offer.
This is incredible. Again, so Genesis Healthcare, you have other ways, you have imaging as well in terms of detection here as well. Besides the PSA, besides the digital rectal exam, you have amazing imaging here as well.
Yes, we're fortunate in having one of the few centers in the entire country which can also provide imaging. Behind you, Laura, is a DEXA scanner which is used in our evaluation of bone health to find low bone mass or osteoporosis. And we have a state-of-the-art PET-CT scanner, which we use for our bone scans and for standard cancer scanning, which can include prostate cancer patients as well.
And really the message we want to hammer home on September, actually, you know what, we're going to quickly, in the time that we have left, we are going to move and show you one of their groundbreaking imaging systems. We only have about a minute left, but we wanted to show you this because this is why Genesis Healthcare is so amazing. We were trying to get in here earlier, but there was actually a patient being screened. But if we want to go ahead here and show you, go ahead, quickly show. Now, what does this do? What does this machine do here, right here, Dr. Kipper?
This is a PET-CT scanner which will do a combined study with a CT scan and a PET scan, which typically looks for cancer, put the two studies together and allow us very fine anatomical detail and evidence for metabolic activity as in a tumor.
That is amazing. Again, this is Prostate Cancer Awareness Month this September. Again, prostate cancer will kill, I believe it is about close to 230,000 men in a year. Our husbands, our sons, our brothers, and we want to make sure that you know that early detection saves lives. Make sure you get that PSA test. Make sure that you consult your doctor. For now, that is the latest. From Claremont Mesa, Laura Kavanaugh, I'll send it back to you.
All right. Well, I am the poster child for early detection, so I appreciate you getting the word out. Thanks, Laura.